Hi, for those of you who've been following my prostate cancer journey, I just wanted to hop on here and give you a quick update. For those of you who might be new to this channel, just a quick recap. I was diagnosed with prostate cancer in November of 2017. In February of 2018, I had my prostate removed. And then I have had two different recurrences of cancer that have caused me to have two different rounds of a combination of radiation and hormone deprivation. And in the last few years, we have seen trends of my PSA continuing to spike. I have done a few rounds of Lupron to manage the rise in PSA. But as of today, we have never seen the cancer again on a scan. So that's the good news. Even better, I have found care at MD Anderson out of League City, Texas. And I am no longer on Lupron. As an alternative, what we've done is we have moved to a medication called Nubeca, I think is how you pronounce it. And essentially that medication's intent is to block the testosterone from the cancer accessing that testosterone so it can grow, because that's what it feeds on. For me, that's been really important because one of the things that I have worked with my medical team on is really finding the right balance between quality of life and also ensuring, that I extend my life expectancy and manage the cancer. So that's what I have been doing. In fact, I'm actually on the medication now. And I will probably stay on anywhere from 30 to 60 days based on previous rotations on this medicine. Some of the benefits to me personally are I don't have as many side effects as I did with other hormone deprivation treatments. I don't have the intense hot flashes. I still have some, but I don't have as many. The fatigue is a lot less. And most of all, I don't experience a loss of sex drive. The medication does cause a spike in testosterone, which is quite interesting. Typically, I am hovering around 500 when I'm off the medication, and I spike to about 900 or even a little higher on the medication. Which sounds good in a way because, those hormones are great for men, especially men of my age. However, it does cause also a spike in estrogen. So in the past, a couple of things that I've had to deal with is really just like nipple sensitivity, and I will get lumps in my chest, all of which go away as soon as I cycle off the medication. In this particular round, one of the things that the doctor recommended is that I bind my chest or somehow like restrict friction that occurs when just like living day to day in your shirt and clothing rubbing. So I actually bought pasties that I wear, which have helped tremendously. So far, I'm about 3 weeks in and I haven't had really any lumps that have appeared, and my nipples are not as sensitive as they have been in the past. So that's my current treatment. I go in annually. I have gone in on 6 months intervals, but now we're moving to an annual full body scan. My scans since the very last round of radiation have all come out very clean. They cannot detect any of the cancer. In fact, the doctor did feel comfortable moving me to annual scans because he believes that my PSA is not a direct correlation to the cancer, meaning I probably do have cancer cells somewhere in my body that are floating out there, but they're so microscopic that even on the best scans, they cannot detect them. So as long as the cancer is not clustering, then I'm doing well. And We're just going to continue to cycle on the Nubeqa just to continue to try to lower that PSA over time and kill any of that residual cancer that remains. Because without the testosterone over time, the idea is that each time I cycle on, I weaken that cancer, and eventually the intent is that you kill any of those remaining cells. So all in all, a very positive update. I apologize. It has been a long time since I've given an update. I actually haven't been on monitoring comments and feedback and really engaging, but did want to hop on here and give everyone who's been following me just a quick update. Thank you, and I hope these videos are helpful to you in your own journey. Again, I'm not a medical professional, so don't take anything that I've said in terms of medical advice. But if you get anything out of it that might, prompt you to raise questions or ask questions of your own physician and see what's the right treatment for you, I'm happy to pass that along. So thank you, and I will try to do better about giving my updates. Thanks, guys.